ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now that's affecting emergency physicians and patients. I'm Laura Worcester.
Across the nation, families, communities, and our emergency departments are already feeling the impact of COVID-19. We appreciate the tireless work you're doing, and ACEP is working at the highest level of our nation's government to ensure you have the resources you need to fight this public health crisis on the ground. Recently, ACEP President Bill Jaquez participated in a briefing with top White House officials, including President Trump and Vice President Pence, and a small group of other medical societies to discuss ongoing efforts to combat COVID-19 and specific ways the administration can provide better flexibility and resources for physicians and the broader healthcare system. Much of the discussion centered around the need for additional PPE and expanding access to testing, with the administration noting that more efficient analyzers should speed up the testing process and increase capacity soon. However, we know that the lack of PPE is still of dire concern. While we were assured that significant steps are being taken to increase production of PPE by private industries, the timeline for this production remains unclear. So ACEP is also in contact with private companies about donations and is exploring other means of ensuring emergency physicians and other frontline responders have access to this important protective equipment. In addition, we are running a grassroots campaign to tell the Trump administration and Congress that they must exhaust every option available to increase PPE production and prioritize distribution to you and other frontline providers. You can lend your voice by going to the link on the screen. To date, over 100,000 emails have already been sent to Congress through this ACEP-led effort. ACEP is also in communication with the Occupational Safety and Health Administration, or OSHA, to get further clarification of your rights to stay protected while in the ED, even when using your own individually obtained or developed PPE. To help inform the Trump administration's response to COVID-19, ACEP sent a letter to the Secretary of Health and Human Services, Alex Azar, to outline some key gaps that, if addressed, could help provide the clarity and flexibility necessary to protect patients and frontline healthcare workers. And we're starting to see some policy changes as a result. Thanks in large part of ACEP's advocacy efforts, CMS will very soon be issuing revised EMTALA guidance that allows medical screening exams to be delivered via telehealth. Acting on another one of our asks in the letter to HHS, CMS will also delay merit-based incentive payment system reporting requirement. ACEP has also sent a letter to Congress to ensure that relief funds are made available for physicians suffering the financial consequences of the COVID-19 outbreak. Specifically, we requested financial support for emergency physicians who are either already treating COVID-19 patients or who are in the process of preparing for a surge of those patients in the coming weeks. The strain of these uncertain times is enormous, and your health and well-being are a priority. That's why ACEP created a discussion forum on the Engage platform for you to connect with other emergency physicians and crowdsource ideas or share in these hardships. We are also looking at more creative ways to encourage social distances while building a sense of community. In addition to digital avenues, we have a "We go to work for you, so please stay home for us" sign that you can download and display on your car. Stay tuned for other ACEP-led initiatives to build support in communities for the important role emergency physicians are playing on the front lines of the COVID-19 response. Thank you again from everyone at ACEP for putting your life on the line to protect all of ours. We will keep you posted on our efforts and progress in the weeks and months ahead. I encourage you to visit our webpage, acep.org/COVID-19, for more information about the latest clinical guidance, our strategic plan, and our policy recommendations. That's ACEP's Capital Minute. I'm Laura Worcester. Thanks for joining me.